fact that the Minister seems to have had a broad welcome for it, and hopefully at the Budget Committee we'll discuss it further. Thanks, Cam.
Deputy Pringle.
Thanks, Ceann Comhairle. I'd like to just start off by welcoming the Future Healthcare Committee report, but unfortunately I think it will sit long and time on the shelf before anybody will dust it off and have a look at it again, because we won't see. I would have no faith in the two larger parties in this House to actually implement it, because it goes against the ethos of what they are developing in terms of a health service. 660,000 people on waiting lists and 100,000 people waiting for outpatient clinics is an actual sad indictment of the treatment of the health service. Indeed, going back over 30 years by this House, when you see that the health services hadn't recovered from the cuts in the 1980s by the time the cuts in the 2008 came around, and they still haven't recovered to this day. And Deputy Bruin there mentioned about people waiting for cataracts. Well, I know a constituent of mine who had to have cataracts removed and was told that he would have over a year to wait in Sligo Hospital for it to be done. And he asked his consultant then, well, what about if I go private? And the consultant said, oh, we'll have you in 2 weeks. So he paid €800, and 2 weeks later he went into the same public hospital to have his cataracts removed, and that was done for him. And then he got a second eye done a couple of weeks later as well. But if he was in the public system, he'd probably be blind by the time he would get it treated. And that's the kind of health service that this government, the previous government, and all the previous governments before them have developed and pushed on top of us. We have a situation now where managers of our local hospitals are actually suggesting to patients who are looking for appointments to go to the treatment abroad scheme and get seen there. That's a sad reflection, and it's a difficult thing for any manager in a health service to actually suggest that to people, but that's what they're reduced to. Particularly when you look at, I know of one patient who is told they'll have to wait 4 years for a lung capacity test in our local hospital. Then we have patients who have been triaged for an urgent orthopaedic appointment, being told that it's a 2-year waiting list for an urgent orthopaedic appointment. That's the situation that we have right across the country. And the Fianna Fáil's only solution is to ramp up the treatment purchase fund and again pump money into the private sector to actually to try and deal with this issue, which actually won't deal with it, but what it does do, it puts a lot of money into private consultants and into private hospitals. And ultimately that's what the goal is. What we need to be seeing done, and what we have to see done, is open up the operating theatres, make sure that they're working in our hospitals, and make sure that and provide the staff for them to operate, and they can deal with our public lists. Our public hospitals can deal with our public lists if they are actually funded to do it. Thank you.
Deputy Connolly.